it's Unity Web TV back again. We still have Jürgen here, and we have been talking here in between, and he has lots of interesting stuff here, so we had to do one more interview here. This time we're going to talk about mental field therapy. That also is healing therapy for traumas and all these things. But you have to explain it very simple to me. How does that work? Mental field therapy.
Mental field therapy basically is, first of all, it's developed by Dr. Dietrich Klinghardt, Seattle in the US. He's a German doctor who lives and works in the States for almost 30-35 years as a medical doctor and a psychologist. And this mental field therapy goes back on a man called Roger Callahan, and he was a very famous psychologist or psychiatric doctor, I think, I'm not sure of it, in the States. And Dietrich Klinghardt and they visited each other's courses, so enriched their work. And so Dietrich got to know his work, and Callahan got to know Dietrich's work, and then Dietrich was allowed to improve or to develop this a little further, and basically is using tapping on, basically just tapping on traumatic experiences in a therapeutic setting, with a therapeutic dialogue, with some things you have to take care of. And for instance, it's a kind of three-point attention we use to make the client, concentrate on three things at the same time, and then use tapping to, let's say, restore or rebuild the own energy system. That's what we call the mental field. And the mental field is not just the aura, or what we have these esoteric concepts also, it's part of it, but also formed or created by light. And we talk about the physics of light and not the esoteric aspects of it. So for instance, the body is always emitting a little amount of biophotons, like light, very small amount, but with a very high structure and a very specific order and abilities and qualities. So for instance, this light can carry a lot of information. A part of this light is not being touched to time and space. It's a quantum physics on it, and so on and so forth. But basically, all information, what we experienced in the past and what makes us as a human being, is stored not in the brain. It's stored in the field. In this, structured by a photonic field, which is different for you, because you made different experiences than for me. And then, what happens is, when we use specific lines and areas for tapping, I can show some. One is like this. The other one is here, the eyebrow, like this. Or this side from the ear to the eye, like this. Like this we have here. We have this area here, here. We have this area here, we tap here, we tap here. We're not only tapping meridian points, for instance. Every meridian is ending in the finger. So when I tap with all my fingers, I tap all meridians. Or for instance here, we have these certain points of ganglia from the neuronic areas, like ganglia here in the brain. And we tap also this part. And we also tap bones, for instance, who are like representing the whole body, like we know from the ears. There's specific areas here on the skull representing the whole body, in order to balance it and bringing back, so to say, energies that in a trauma, when you have a heavy trauma experience, some parts of your energetic field, they go back out again. They've been ripped off. Some parts of the fields. In German we have these tellings, I'm standing next to my shoes. I think it's not English, but I'm standing next to me. I'm off the track. And these are describing a little bit what basically happens when you're in heavy stress. Your field is a little bit not in the center, and you're standing next to it. And then, of course, with all these effects taking place. So when people really can remember traumatic experiences of the past, or the now, or even the future when you are afraid of your examinations, for example, we use these tapping techniques and the dialogue and some other aspects of therapeutic, being together. We use it to balance the system while the client is going through a painful process, maybe, of memorizing things.
Yes. Well, this is the same as TFT, tankefeltterapi?
Yes.
Callahan was the founder of TFT, but as
Exactly.
he said, Klinghardt and Callahan were friends, so they kind of exchanged their experiences.
Okay.
Yeah, it's based on third field therapy.
Yes.
But since Dietrich Klinghardt is a doctor, he also made a lot of investigation and research on it, how it is affecting also the cure of really, he's working with really heavy clients. He told me once that basically when people come in his clinic, they have seen in average 23 doctors before. So he's this kind of doctor. And he was always interested in what can we do to make it more easy and that everybody easy can do it. So we train our clients to do this back home, work on their affirmations, work on their feelings, work on their attitudes towards life. And with this tapping, the teachings we do on it, it's quite easy to learn. It's very simple, very structured, but very effective on trauma. You can remember. So basically, we lead the client towards the painful trauma, and then the client gets, of course, emotional maybe, or gets into this field. It's not only the tears or the feeling, it's also the specific electromagnetic field around him. And when he is in distress, then we use these very specific techniques to detach the trauma, like I said before, from the diminishing effect in the body. So that's a very easy way. So Dietrich always said, every housewife should do this, should learn it for the children, for their kids. And we also, I'm staying with friends and they have a lot of animals. And I tapped once a turtle. And it's true. I tapped even once a turtle. The turtle was running always, always running until the feet were sore. And I was having it on my stomach and tapped it very slightly. And I went into a field of, I'm centered, everything is okay, and tapped. And my thoughts I was giving you, it's easy, and then it was in May, and now they told me the turtle still is not having sore feet. So the tapping even worked on the turtle. This is a funny example, but it works so strongly on small children, animals, or people who are not in this this doubting brain wheel going on. We see this there very clearly. And with the clients for the traumatic treatment, we have seen such good effects, or we have seen good effects on dealing with phobia, when people are afraid of spiders or for elevators. For instance, client, she could not drive at night the car. I was give her 2 treatments with this specific treatments, and now she could drive to me in the winter time. It was dark. In Germany even, we have darkness at 5 o'clock, so for her it was very important to be independent, and so on. So it's very easy to use, and really specifically developed for everyone. So
But people in lots of therapists are working with TFT,
Okay.
tankefeltterapi, I don't know. But your techniques take it a little bit further.
it seems like I'm not 100% into thought field therapy, and I know it's a very good system, but what is basically the difference is that Dietrich Klinghardt brings together the physiological as the effects of physics, the new research on physics, the new research on maybe treating autism or treating specific issues from the medical point of view, and of course treating trauma. Like his brother is a psychiatric doctor, and he's doing research on trauma and how you categorize it, and so of course they exchange, and we have maybe a little different categories of traumatic experiences, and so many influences we put together, making it a little bit more wide range. This is what I experience. We can work with this method for traumatic experience, but we also, when we take it a little further and the therapist is experienced enough, we also do systemic family constellation or family work, like Bert Hellinger, maybe you've heard about this systemic work. We can do also with this. Yeah, we can go very far with treating people like this, but we can keep it also very simple, that literally every housewife can do it, and mostly they are the best, because they are not spoiled in the sense of it has to be like this and I compare like that, this system is very good, this system is not. They just don't care, they do it, and they're very good in it. So of course this is very good.
I have one question, but then more for curiosity.
Yes.
You talked about your feelings, your traumas you push out out your body. Is this the thing that the shamans working with? They take your soul parts back again.
Yes.
They have their own techniques.
Yes.
So this is more scientific technique with the same thing.
Sort of like but you have two different layers. We have this five level of healing from the Tantric yoga, and we have the physical level, the electrical level, the mental and the intuitive level, and the God level. I make it very shortly, just give you an overview. And the shaman techniques, when you lost part of your soul in some accident, in some whatever, it's the intuitive part of it. Yeah? And the mental part, also some parts can get lost. We see this in the research also when people having heavily trauma, car accident, and they think, now I'm dead. A part of the mental field, really the electromagnetic field, is going out of the body, waiting until it's done, to make you not feel this heavy pain of dying. But then, all of a sudden, the person maybe survives. But
Is that called shock?
It's a part of the shock. Literally, if you have a trauma and you have the shock, some part of the energetic field, the electromagnetic, is going away. Plus what the shaman called when they bring back the souls, maybe a part of the soul. But it's two different layers. It can be both. It can be one of it. But mainly what I see as a therapist, basically the electromagnetic field goes first, and if it's too heavy, the soul, part of the soul, says goodbye, but the body is still here. This is what the shaman, they do the same work.
Yes.
Yeah. Okay.
2 minutes left.
2 minutes left.
Okay, but do you feel have you explained what you mean about?
Yeah, I explained 3% of it.
3% of it. Okay. If you want to know more, you have to go on the courses or go on. Are you gonna have more? Are you gonna have more lectures with these people?
Yes.
Yeah.
Okay. So
we're
we're gonna have a lecture this evening today, but the coming.
We are going to start a training in both mental field. Hei, det sitter bra. Du kan gi meg. Ja. Vi skal starte en utdanning i både mentalfeltterapi og autonomic response testing, Lys-kinesiologi og psykokinesiologi denne høsten med Jürgen og Gudrun. Så bare sjekk baldron.org eller ring oss, så skal vi fortelle deg mer.
Yes. Ok, da tror jeg vi takker for den gangen. Og thank Gudrun and Jürgen for them staying a whole hour here telling us a little bit about what they're doing. So thank you very much, both of you.
You're welcome.
Takk til deg, Rafael.